Johns Hopkins Health System research lets us know that we have a deficit of approximately 80 healthcare physicians and internists over the next 5 years. And that's just unacceptable and something that we can work on, especially as we are a graying community. And so that's why I'm so excited to announce, in collaboration with so many others, this innovative, exciting approach that we're calling Practice Howard, where we will provide targeted and limited investment that will bring more primary care providers to Howard County. And we'll do this by having the resources for recruitment of the best doctors and working with the very best practices and doctors' offices. And this initiative will provide loan repayment and housing assistance so that these young doctors can make Howard County their home and put down those roots and be part of our community. And this program is a true example of a public-private partnership that works for all of Howard County.
When the county agreed to do this and thought it was a great idea, we undertook a competitive RFP process to reach out to existing community medical practices to see who would be the best participants. We selected in this initial round 2 medical practices, and you will be hearing from them in just a moment, to take part in this intensive program. Practice Howard fills the gaps that prevents doctors from coming to this community. As many of you know, this is one of the more costly places to live in America, but it is also one of the most amazing places to live in America.
Over the years, Columbia Medical Practice has been able to recruit excellent providers with competitive packages and benefits. But right now we find ourselves competing with organizations. They have other perks for the doctors, including tuition repayment programs, loan assistance, and other supports.
I'm super proud to be a resident of Howard County. I mean, it is really a great place to live. I have 2 small kids. I'm so excited to be raising my family here. So it means a lot to me that I can have my professional needs met here as well as my personal needs. And I mean, I've been in other practices where, you know, the focus was on patients, but I felt, you know, resources and there were a lot of logistics and things just weren't happening the way we wanted them to happen, where the patient was truly at first. So now I'm excited. Things already, I've been here a few months and it's been a good path. I'm so glad to be a recipient of this because we all know Howard County is a great place to live, but it is not not cheap, especially for those of us who are just starting out.
I think it's unrealistic to say you're going to go into medicine to make a lot of money, because that's just, there's easier ways to do that. But the truth is, we incur huge debt. I did not have huge debt. I have a friend who's another emergency room physician who owes $340,000. She just finished training. She doesn't know when she's going to pay that off. I have another friend who's a pediatrician who graduated when I did, who's been training, now working for 23 years. He just finished paying off his loans, but he was able to do that because he was in a loan repayment program, that without it, he'd be paying off into perpetuity.
Through this program, we anticipate that we will be able to ensure that about 4,000 Howard County residents will have better access to primary care just this year alone. And these relationships that they build with their patients and with the community are fundamental to building a stronger, healthier community. And having annual checkups and screenings help everyone detect disease earlier and live a longer, happier life. And then even when there are chronic conditions, they can be managed better. You know, oftentimes in Howard County, we're known for a strong economy, our investment in education, our recreation facilities. But if people are sick, none of that matters. And having health care and wellness be a prime factor in quality of life does make Howard County the very best place to live in the nation.